Hormonal IUD. We'll be ready to get going here in just a moment. Appreciate everyone standing by as we get ready to begin. We'll be hearing from wonderful, wonderful expert voices today. And we will be getting started just at the top of the hour here because, as you can imagine, we have a lot to hear in the short hour that we have together. So we will be getting started right away, as close to right away as we can. We'll have people joining from all over, so we will be trying to give just a little bit of time for folks to get started with this event. And just as we hit this turn of the hour, I'm very happy to say hello, everyone. Welcome. Thank you so much for being here. We'll give it just another moment, and then we'll jump right into the introductions. My name is Gracie Levitt, and I have the pleasure of being part of a small and beautiful team helping to organize activities in support of the Hormonal IUD Access Group. We are so happy for you to be here today. Thank you so much, everyone, for your patience as we jump right into this very special conversation. Today, my honor is to help kick off this very special one-on-one perspectives on introducing the hormonal IUD. Very shortly, we will hear our experts introduce themselves, so you can hear in their own words about the tremendous work that they have been doing, that they are doing right now. And then we'll jump into hear a conversation between the two of them so that we all can benefit from hearing their experiences, their expertise, their wisdom. We thank everyone so much for sharing their energy and being present today. We have just a very short hour together, but we will make tremendous use of it. Many of you will be familiar with the Hormonal IUD Access Group, which is a global consortium of governments, donors, researchers, manufacturers, procurement agencies, and service delivery groups that are collaborating to expand access to the hormonal IUD in low and middle income countries. During the event, you are likely to see QR codes, perhaps links in the chat to our Hormonal IUD Access Group website, and also links to sign up for the newsletter. Some of you have already signed up for the newsletter in getting ready for this event. Thank you so much for doing that. It's a great way to stay connected. Speaking of the chat, we will be turning to at least a short time at the end of this event where we will be able to take some questions from the audience. And we really encourage folks throughout the event to be sharing questions so that we will be able to hopefully have experts have a little bit of time to respond to those at the end. What we will say is that also reaching out to the Hormonal IUD Access Group with any questions means that especially that potentially are unanswered or unaddressed today due to lack of time, means that we also might be able to use those questions to help fill out events or offerings in the future. So thank you so much for sharing your thoughts, your feedback, and your questions with us. With that, I am again so fortunate to turn this over to our guests, and we would be very happy to hear our guest experts introduce themselves. Thank you so much.
So thank you and good morning. My name is Dr. Kingsley Odogwu. I'm based here in Nigeria and I work for MSI Nigeria Reproductive Choices. I am a reproductive health physician. I'm the Director of Clinical Services at MSI Nigeria, and I am very, very happy to be here. The work that I do in MSI Nigeria and the passion for the community-based work that we're currently doing was born out of my passion to reach out to the vulnerable and hard to reach in the society with family planning and other sexual and reproductive health services. As I speak, we have over through outreaches and also through a model of community-based distributor network, working with over 300 of such clinicians working in the field and reaching out to women and girls in need of services on a daily basis. And we have grown significantly, and now we have over 24 outreach teams that we're working with. And I'm very happy to be here to share more experiences. Thank you.
And I think it is possible that unfortunately we may have just lost Flora for a moment, and we will hopefully get her back in just a moment here. Dr. Kingsley, you are actually up to ask the first question. Would you mind going ahead asking that question and first responding to it yourself?
Yes. Just a minute.
Hello.
Yes. Okay.
Hello, Flora. Hello, Flora. We were just about to jump into questions, and so sorry that we lost you for a moment. Thank you so much for working to come back. Would you mind introducing yourself before we get into the questions?
Okay, so good afternoon, everyone. I'm Flora, based in Longwe, in Malawi. I'm a social behavior change communication manager working with family health services. So family health services is the local organization that implements programs aimed at improving the lives of Malawians. FHS as a project, as an organization, has some health areas that it is involved in. These include HIV/AIDS prevention, sexual reproductive health, as well as malaria prevention. So my work as a social behavior change communication manager, my main goal is to design interventions that increase the knowledge and awareness and access of SRH services, particularly young people. Thank you very much.
Thank you so much to you both for introducing yourselves. And now we can move on to that question. Dr. Kingsley, if you wouldn't mind getting us started, and then you each can respond. I'll be quiet for quite a while here, but ready to jump in as needed.
Okay, thank you very much. Just to talk a little bit about what brought me to community-based work, and also what keeps me working in and around it, and also my pride and my passion, and also talk a little bit about some challenges we can learn from. If we know Nigeria is a very it's a populous country with a very vast rural population, and also with a very high unmet need of family planning, and the contraceptive prevalence rates at the moment is pretty low, about 12%, meaning modern methods of contraception is really a huge challenge, and that has its impact on the number of women that die every day from delivery, from pregnancy and its related causes. This is a huge public health issue in Nigeria. And I started up my work in the hospitals, and well, more or less like a tertiary hospital, but I had this I was not getting what I needed in terms of my impact in reproductive health, because we were not we were seeing cases when they are almost late, managing complications, maternal cesarean section and other hospital-based work. And I realized with our work that a lot is really happening in the community. There is a huge unmet need in terms of contraception that can actually prevent some of this work. Contraception plays a critical role, and therefore I decided to move from the walls of the hospitals to the community, where I joined MSI Reproductive Choices, and we started the work. And the impact of this work today is so huge. At the moment, we have over 3,000 public health centers that we are supporting. We have on a daily basis, through over 24 mobile outreach teams, we reach out to women and girls in very difficult terrains and hard to reach areas with contraceptions and other SRE services, and also with messaging and counseling. And we also have what we call the MS ladies, over 300 nurses or community health clinicians whom we train and equip them with requisite knowledge that will empower them to be able to communicate in very difficult terrains where there are no access routes. With this strategy, we were able to reach a lot of women in their need of contraception, and we are making more impact in terms of uptake of modern methods of contraception, including hormonal IUDs, and broadening the method mix, also giving them choice so that they are able to have access and be able to have a quality reproductive life. There are definitely challenges also that we have encountered, especially when operationally, and that is the fact that commodity availability can often be a challenge, and sometimes its non-availability can also affect uptake, especially when the need is there. And this is what we're doing to work on the logistics to ensure that we at every time go with the full complement of method mix, that we're able to reach clients so that whatever method they choose to take up, we are able to meet them at their needs. I guess that's something that I'm proud of doing, and I'll continue to do. Thank you.
Okay, thank you, Dr. Kingsley. I think for me, why community-based work is interesting and also something that's close to my heart. It emphasizes for local knowledge. There's values about what the local people want and the experiences that the local people have in addressing their own challenges. So I think for me, community-based work is because we are coming up with solutions, but not imposed kind of solutions, but solutions that the community themselves ideally say this is how we want the services to be provided to us, and it's really in sync with what the community themselves want. I am proud of prioritizing the involvement of community members in decision making. That's why I think community-based work to me is something that's key, because it is effective, because now you have the user themselves who are part of solving the problem. And when it comes to maybe the challenges that I've noted, especially when it's around issues of family planning, hormonal IUD inclusive, I think you've already mentioned issues around the availability of commodities. I think that's also a challenge when it comes to community-based work. because sometimes the community-based agents can create the demand for the services, but you find that the commodity is not available. So those are some of the challenges that I feel are there when it comes to community-based work. But the community-based agents who are there, the volunteers, the community-based workers, the community health workers who are there to provide information in the community. Some of the challenges they face is how we are going to dispel myths around contraception. I think contraception is an issue that there's a lot of information, a lot of counseling. So sometimes to dispel some of the myths that have been created in the community are also challenges for community-based workers. So I think that's what I can say about what made me come into community-based work, and why I keep working around this is it's really because of how the community themselves are used in terms of coming up with solutions, in terms of the challenges that I'm learning from, especially around hormonal IUD, as I've already indicated, the stockouts are issues, dealing with misconceptions, but also that community-based agents are there to provide like referrals to clients who want to get or access the service. So sometimes the lack of service providers who can provide this hormonal IUD also is a challenge, because sometimes community members would hear about hormonal IUD, want to get the commodity, but because we don't have enough providers who are trained in providing the hormonal IUD. So this is also another challenge that I can point out to. Going to maybe a next conversation. I don't know, while community health workers are not able to provide hormonal IUD themselves outside of the facility, what are your thoughts on the role that they play in these circumstances? Dr. Kingsley, what are your thoughts on this one before I come in as well?
Yes. So looking at community health workers, especially as it relates to being able to provide hormonal IUD outside their facilities, the community health workers are actually they play a very key role in helping when they don't have the skills to be able to be equipped with the right messages. Information, they say, is power, and being able to provide appropriate information around the benefits, and as well as also be able to dispel myths and misconceptions, and their ability to recognize clients that have need for this and be able to refer as appropriate is very, very critical. When they are not able to provide the service, they should be able to link up with the clients, providing appropriate information, as well as linkages with sites where we have trained providers that will be able to provide such services.
Okay. Yeah, I think just as you have pointed out, I think like in Malawi, community health workers, we have different cadres. We have what we call health surveillance assistants. We have the community-based distribution agents. We have community health nurses. We also have volunteers who are working as community health agents, providing different information on family planning methods. So all these cadres are not able to provide the hormonal IUD, but they have a very a key role in ensuring that they are providing the correct information to people in the community, um, and they are also promoting the utilization of hormonal IUD. So the information really, the community-based agents really need to have enough information and should be conversant with the different family planning methods so that they can provide information on all family planning methods to ensure that people have choice, but they can also be able to talk about hormonal IUD in detail if a client wanted to hear more about it. So that's one of the key roles that they play, that's information provision. But I also see them as a, a contact within the community that is able to build like trust with the community members themselves, because usually these cadres are people within the community. And so when they talk about family planning methods, when they talk about the IUD, they have conversations with community members, and there's a lot of trust because information is coming from somebody within the community. Unlike maybe when people hear information from different sources, but coming from a community distribution agent, this information coming from somebody who belongs to the community, there's a lot of trust that is fostered within the community. So I feel those are some of the areas or the roles that these community-based agents are playing the community. You've talked about linkages. I think that's very key because they are the ones that are ensuring that these referrals of these possible clients who want to get a method, being able to refer them to the facilities. In the case of family health services, we also have like mobile outreach clinics. So even referring clients to mobile outreach clinics, especially in the hard to reach areas where probably facilities could be far for the clients to access healthcare. So specifically, I think these are some of the areas I feel that community health workers play a big role in ensuring that family planning comes closer to the clients within the community.
Yes, thank you very much. Just also thinking through, just also taking the next. There are potential clients and other community members, I mean, there are potential clients that really have need for these methods, hormonal IUD. What potential role can the community-based workers really play in helping clients to learn about their menstrual pattern and changes they may experience when using this method? I think the clients that will most likely, first, these hormonal IUDs they are basically methods of contraception that will help to space pregnancy or to limit pregnancy as much as possible. But it has the additional benefit of also being very, very suitable to clients with heavy menstrual flow. I think that is that's one unique advantage that's potential clients that will benefit from this method have. The fact that there are menstrual challenges definitely that women often encounter, and these menstrual challenges can be disturbing, affecting the reproductive health of a woman, as well as also affecting the quality of life in general that she lives. And this is a very, very disturbing issue, not being able to predict and not able to predict when the bleedings will start or when they are very heavy, especially in very hard to reach areas in the community where you don't have the needed personnel or persons that you could meet. Hormonal IUD really, really, really aids benefits. It has that added advantage. And community-based workers can go a long way with this understanding to help talk to clients about some of these potential benefits, and also bring in the fact that they should understand their menstrual bleeding patterns, understand what is normal and what is abnormal, and the fact that hormonal IUD benefits is able to also take care of other non-contraceptive benefits ranging from heavy menstrual bleedings and irregular menstrual patterns. Community-based workers are and agents that work in our communities are very, very key in ensuring that this messaging is clearly communicated in a way that clients will understand. And still talking about this education, it is also very, very important because in the community, there are agents, these are persons that the community trust. They know them. And when they are trained with the right messaging and also given appropriate capacity building, they are able to provide the appropriate information. And not just appropriate information, they are also in a very good position to dispel myths and misconceptions that may arise, and able to answer questions that is within their reach. They could refer to the healthcare provider for further questions, especially when it's beyond them. But the first point of call that gives confidence to the client is usually from these community-based community members. And therefore, it's really, really, really a huge benefit that their menstrual changes is also part of what the conversations is, and what to expect, and what experience they will be having when using the method. It will go a long way in helping clients that take up this method to be able to use it over time, and find out that continuation rate is usually very high in those that have an understanding of what to expect. I don't know what Flora thinks about this.
Yeah, you're very right. For me, a community health worker should be able to explain some key things to potential clients. So issues around what is the community. So a community health agent or a community health worker should be able to explain what the community is. Clients will be very curious to say how is this method inserted, or what is this method all about? So if a community health worker is able to explain what the method is, how the method is inserted, and any issues around the bleeding, as we talked about, or what the client should be able to expect in case they decide to take this kind of method. So a community health worker should also be able to provide the proper education to the client, and I'm also fond of issues around even the visual aids can also help a potential client to really understand the method. So not just the education where they are just speaking about the kind of method, but should be able to provide even the visual aids to the potential client so that they have a better understanding. I think sometimes people are scared, have questions around what method to take because they don't have that much detail about the method. So I think a community health worker should be able to explain this method with the use of these visual aids. Like in Malawi, Community health workers, they are trained, but they're also provided with what we call Kulila flip chart. So it's just family planning flip chart, where it has all the different methods, including the hormonal IUD method, so that clients are able to visually see these different methods, understand them, and when they are making a choice about this is the method I want to take, we should at least have that much information. What I also feel the community health worker does or has the opportunity is that they encourage the clients to ask a lot of questions, because when they're explaining about them, there's that one-to-one kind of conversation with potential clients, and potential clients are able to ask a lot of questions about the procedure itself, about the method itself, which is something that can help the client understand even any breathing patterns that are there or involved when they take up this kind of method. So in summary, a health worker, a community health worker, will be able to explain to potential clients how the method works, the breathing patterns that are there, the duration of this method that they have decided to take, and also be able to provide assistance on where they can get more help if there are any side effects. I think once they provide such kind of information to a potential client, the client feels comfortable to get that method and continue to use that method. As you pointed out, that there is the usage of the hormonal IUD continues on if a client really understands and is able to get the benefits of this method. So I think that's what I think around what a community health worker can do in terms of giving the relevant information to potential clients. Moving on probably to another area that I would want us to talk about is like for when it comes to community health work, there are different people who are involved, or should I say, different levels of people who are involved in community health. We have the community health worker themselves. We have like program managers who are providing the outreach services, and we also have community members. So if there was one thing that I would want each of these different people who are involved in community work to know, for me, I feel that the community health worker, it is important for the community health worker to understand that active participation by the community is very key in ensuring that we have better health outcomes. So that's one thing I would say around community health. That's one thing I would want a community health worker to understand, that the active participation of the communities is very key in ensuring health outcomes. For the program managers, one thing I would want them to know about community health, or that's something that they should carry with them, is the issues around integration of curative and preventive health. I think health workers themselves or program managers, we look at the end point of health, but should also understand that the role of the community health worker at community level is to provide the prevention of maybe a disease to actually come out. So for me, one thing that I want program managers to understand is that there's that integration between the actual service that is provided to the person and how the person can prevent, or the client can prevent a disease because the community health worker has provided the relevant information. So in relation to family planning, I think it is important that program managers also understand that there is a role that community health workers play at community level in ensuring that the client is able to access the service. So accessing a service just doesn't come like that. It comes because this client has gotten enough information at community level and has got informed choice. Once they go to a facility, they get the method that they decided to get, and this method comes in because they have enough information that they've gotten from the community. So for me, it's that intervention where program managers should understand that there is a key or a big role that community health workers play in ensuring that the client is able to get an actual service. When it comes to one thing that I would want the community members to understand about health, I think for me is that communities have a very good insights around what is needed within themselves. Like they're able to decide or make decisions around their health outcomes. And so one thing I would want them to really understand is the role that they play in ensuring that at the end of the day, communities have better health outcomes, communities or clients are able to access different family planning methods.
Okay, if I can also add on that, just like you said, I will also want program managers to also not forget to invest in training of community agents, identifying there are different community structures that serves depending on the type of community. And some of these community structures vary, I mean, from community to community. One is identification of those agents and training them appropriately, building their capacity, and that needs some level of investment in training such that the appropriate messaging is passed, and those that when we talk about myths and misconceptions, some of them come from some of the community agents because of incomplete understanding of some of the side effects and also some of the methods used in family planning. So training community agents, conducting exercises around values clarifications and training them on myths and misconceptions. These are very, very critical as part of, their onboarding and capacity building for family planning in general, especially with hormonal, including hormonal IUD. That investment is very key. The second investment is the fact that new providers need to be trained to understand the safety of the service provision and how also to provide a quality service through providing privacy and ensuring that clients the client is happy with the whole conduct of the process. It is key to also invest also in appropriate referral points that must be mapped out for the provision of services and identifying those points and making them handy and available to some of these community agents such that they are passing on the right messaging. They are making referrals to appropriate facilities, and they are guided by what their limits and when they would need to identify and make appropriate referrals. I can go on and on this because it's very, very key to the success of programming and also the way we drive introduce new methods. And rather than assuming that everybody knows, there should be a way of introducing them in such a way that persons, the methods are clear, the presumed benefits are clear, the appropriate messaging is not misinterpreted, and appropriate responsible people know that it is also safe. There is usually this aversion or fear at community level when a new method comes, because everyone will be wondering, what does this do? Hormonal IUD has a unique difference in the sense that people know the regular IUD as not having much changes, as not affecting the menstrual cycle. But here we have a method that combines both hormonal as well as the IUD features, and individuals need to understand that, and then the benefits as well. So this is very, very huge. I can go on and on. I can also share, I can tell you a story about my little experience here about individual that have taken up an hormonal IUD in the past. We have one of my community work in last couple of years back, when we introduced this hormonal IUD, was quite it's something that stays with me. It's a story that has always resonated with me, and that is the fact that we have this. There was a client who had taken the injectables but had to discontinue because of heavy menstrual bleeding. Went elsewhere, took the implants. I think it got worse, affecting her quality of life. She caters for, I think she has like four to five children, and key to her is the fact that she does not want to get pregnant. So somehow she was using an implant because she really wanted to use a method, but what she was experiencing, heavy menstrual flow, was really disturbing her quality of life, made her to stop going to work. She does petty work, and it was at that point that she took her complaints elsewhere and eventually came across our outreach teams. And when she was evaluated for eligibility and everything, there was nothing stopping her. She was eligible. We spoke to her, and then she took up the IUD, the hormonal IUD. When she took it initially, the menstrual pattern was a little irregular, which she understood from the counseling, and later it stabilized. I tell you today, she's currently a mobilizer. She is the one working as a satisfied client to one of the hospitals in our community, because she became a community agent thereafter. And such success stories are always because she's using it and she knows what it is, and she knows what she was feeling, and she knows the impact this have had on her. And that's why the story, there are definite benefits that some women have who are using the method are benefiting from. And in addition to the contraceptive benefits for which it's been meant for. And this is really, really, really huge. Yeah. I can even share even experiences that I've had even in the hospitals. Clients that have irregular bleeding can also be managed that have some mucous fibroid have also benefited from the use of this method. And we can go on and on and on to talk about this. I don't know if,
Yeah,
yeah,
that's
Flora.
quite interesting. That's quite interesting. I think for me, the experiences are quite many, but I think what sticks most to me as an experience is for the benefits that I've seen um, the hormonal IUD as well as like family planning methods being very key in the lives of different clients. For me, what comes most is how young people these days have embraced the issues around family planning, um, enough comprehensive sexual education, with enough counseling, with enough empathy. Young people have been, uh, have been able to embrace family planning, make decisions around which family planning method they would like to take because of the informed choice. I work in a space where our target audience is young people. And when the hormonal IUD came into Malawi, and also when just introducing it as a product, one of the activities that we did was what we call youth open days, where uh, invite young people to access services, family planning services through our mobile outreach clinics, but with a focus on also just ensuring that there's a lot of information about the different family planning methods. So for me, my experience is to see these young people really come out and because of the information that you provided, because of the detail that you've given them about the different families, you find that you also have young people or who choosing or opting to get the hormonal IUD as a choice of method. So I think for me, it's not a specific individual story, but it's really collective because I've seen how young people have been able to make these informed choices about different methods, including hormonal IUD, because of the counseling, the comprehensive education, the empathy that is being um, uh, provided to them during access to different services. Yeah, so basically, um, uh, that's what I can say regarding an individual story or a story that I can say sticks to me about how the young people have been issues around community. I can see also have some questions in the chat. About what role do community-based workers play in helping young partners to learn about the method. There is a question in the chat about that. I don't know what are your thoughts about what is the role of community-based agents in helping young partners to learn about the method.
So men involvement usually in family planning it's generally a very contemporary issue that is being discussed at the moment. The fact that in the community structure is such that by the way the community coexists, everyone wants to everyone wants to be involved in whatever that is happening. And there are some communities that the male dominant, the men play dominant role. Some of them act as gatekeepers. Some of them, they are like traditional leaders in some communities. And also there are also places where you have to talk to some key, traditional religious that are men. And they help to improve acceptance of this method. There are multiple ways of involving them, and involving them helps the uptake, helps to improve access, helps to improve the uptake of the method in the community, and also give confidence and reassurance to the women and girls in the community as to the safety, as well as the fact that they are supportive of whatever methods that their spouses or relations are taking. Men also play this critical role in the fact that when there is a problem like side effects, when they are knowledgeable about these methods, they help also to manage give confidence and help the clients to manage and support where they need to. In Nigeria, for instance, we have there is a program we're organizing, and there is a male involvement strategy that we are also adopting, that where we look for the tea vendors. There are communities where mostly when you go to where we have the tea vendors, they are mostly men. That is where most men come together to discuss early in the morning before they hit the road to do their various. Now, giving education of and training of those team vendors has been really catalytic to improving family planning uptake generally, including hormonal IUDs. Their understanding of what the benefits, and also helping them to dispel myths and misconceptions also goes a long way in helping, talking to their spouses, talking to their court relations to take up these methods, and also understanding the benefits. And we all know that some communities, that these are very, very influential persons in the sense that they will also help talk to other persons, and this will have a critical influence. In as much as we also allow the decision-making process to the clients to be the one to ultimately make that decision. Involving the men improves that confidence, and also help in the continuation as well as the uptake of the methods in some communities. I don't know what you think about that, Flora.
Yeah, very true. I think community health workers do have a big role to play in ensuring that there's male involvement, because generally, I think, I don't know about Nigeria, but Malawi, when it comes to family planning, usually it's considered as a woman's thing, and less involvement in males. But when it comes to the decisions of what kind of method I'm going to take, if this method good for me, you find that the male is involved. The woman would want to get consent sometimes from their partners to them, so to just know about what method they're taking. So even though people look at family planning, it's the conception around communities and family planning is for females, there is a big role that men should play in their having this conversation with their partners. And so the spaces where men are, there's less information about family planning. So community health workers bring in that space where they're able to provide the relevant information to men in their spaces, because sometimes the clinic is not a male-friendly space for men to understand issues about family planning. So community health workers find their spaces. You already pointed out about a place in Nigeria where men festival before they go out. So that's a space, a comfortable space for men to hear about what are the issues such as family planning. So I think a community health worker has that role, a big role to play, where they're providing that information, that convenient space for men so that they can be involved in issues to do with family planning. Also understanding issues around hormonal IUD, because I think in Malawi, just recent conversations around IUDs themselves, not necessarily the hormonal one, are there. Then men have issues around um, the method itself. So I think these spaces where they can be found and spaces where they can get more information about the method, a community health worker really plays that big role. And when you have community health workers who are also male, talking to their fellow men, I think they act as role models as well, in ensuring that they pass out the correct information. So yeah, I do believe that this is a space where can be involved in issues around family planning, especially if there is a community health worker who can speak to this. I'm also mindful of time, but I'm looking at final question chat. For me, I think we covered most of the questions. um, I don't know what would be the question that you feel hasn't been asked in this discussion that you feel should be covered as we are concluding. But in my case, I think we've covered quite enough about uh, community-based work. And I think the big thing for me is we've looked at the importance of community health workers, the big role that they play in ensuring that they give the relevant information to clients who want to take up hormonal IUD. Basically, those are the areas that I have been covered. I'm not sure what else you'd think would do justice to this conversation.
Yes, I think we have also touched base with quite a number of them. And there is also the concern around resentment to IUDs by clients, especially those living in the rural areas. It's a contemporary issue. One of the key things that my work has found is the fact that the clients sometimes the privacy, because the process of inserting an IUD requires that the client is assured of privacy and confidentiality because of the exposure that is involved. And from our experience working in MSI, we ensure that clients take up these services in an area where there is full provision of privacy, and the client is assured that the exposure is not there. And when they are assured and they see that it's just the service provider that has given them that confidence, the uptake is usually high and assuring. it's one of the factors that's making them not to, especially in rural areas, reducing the acceptance that they have by them. Well, this cuts across. It's usually a challenge, but provision of quality service, especially by trained providers that understand the process involved in inserting these methods, goes a long way in ensuring that clients are confident and they can be able to give positive feedbacks that will encourage other clients to pick it up, especially take up the method as well in the community. Don't know what you think about it, Flora.
Yeah, it's great conversations, great conclusion to that, and for me, I think something that you touched on, especially this up to a certain level that community health workers can support uptake of the community. I think it's more trained providers who to give such kind of a service. I think what is involved in the provision of this method is clinical. So there is also a question in the chat to say what will be the low cost intervention to promote uptake at community level. I think because we still want to maintain quality, we have to ensure that standards are followed. Provision of this method has to happen with a trained provider. So in terms of low cost, for me, I think it's ensuring that we have maybe like mobile outreach clinics which have the capacity to provide such a service at facility level. Providers who can provide such a service, but always understanding and meeting quality standards and ensuring that the client gets the best out of this service. I think that's what I will conclude on this conversation.
As we conclude our short hour together, let me say how grateful we are to our tremendous speakers who have offered so much. We have indeed run over our hour. There has been so much to say. I know we could also go on for much, much longer because Dr. Kingsley and Flora, as you have seen, have tremendous knowledge to share with us all. We also have seen some really wonderful questions come in through our chat. So I will say that any unaddressed questions, any questions we were unable to get to today, we will aim to address when we share our recording, which we will be doing. I want to make sure that we thank our audience members for those questions. And we thank very much our audience members who have been watching live today and those who will be watching this recording of the special conversation later on. We will be sharing this via our mailing list when it is ready. And to sign up for that mailing list, you will see here QR codes for both the website and the newsletter, accessible at hormonaliud.org, where you can also find lots of other key resources on this method. You can also always write to info@hormonaliud.org. That email address is also on this website, and you can share any additional questions or comments. For example, while we can't currently guarantee the availability of all resources in every language, if you want to voice a need or a desire for translation of any resource, including this recording in a specific language, we would be very happy to learn about that. Um, so thank you very, very much to our tremendous, tremendous speakers. Again, Flora, Dr. Kingsley, the time you have shared today, the knowledge is so valuable, and we will look to continue to find ways to share expert voices like yours on this very important topic. Thank you, everyone, so much for your participation today and for viewing at a later time. Thank you again.
Thank you.
Thank you.